Everybody got something to write with? No?
Mullins, my name's Cassidy. I'm going to be your occupational therapist working with you this morning. I need to do an evaluation of your basic self-care first. Is that okay with you?
That's okay.
Okay, what I'm going to need you to do is take a sponge bath.
Thank you so
Then I'm
much.
going to have you get dressed as much as you can.
Okay, so one thing I want to point out that she's doing right, this is a lesson for all of you. When you're going to work with a client, it's always a good idea to explain what you're going to do. So the person sort of has an idea of what you're doing, and perhaps if it's something that seems maybe a little unusual, you can explain why you're having them do what you're having them do, because it's not always obvious to clients. So I want you to pay attention to the quality of his voice, the movement of his arms, the movement of his trunk, what he uses to move around in the bed, how he accomplishes it, and so on, okay? So also you can see that she started to set things up. So she already has her bucket of water. So this looks like it's in a hospital room. She has a bucket of water. She has, I'm thinking this is a washcloth with a bar of soap on top. Always better, if you're gonna set up a session with a client, always be prepared as much as you can ahead of time, because it's not like she's gonna start with him, oh, I forgot a towel, leave him, run, and get it. You know what I mean? If he was somebody who could sit up on the edge of the bed, then she would have to lay him back down if he wasn't safe, put the rail back up, and so on in order to go get what she forgot. So always better to be like a Girl Scout, Boy Scout, you know, like be prepared.
By yourself. Then we'll get up in your wheelchair and we'll go to the safety room.
Okay.
Alright, so we'll start with the sponge bath. Here's the towels and washcloths right here. Have you opened the soap? Now I know this isn't probably like you did it at home. How did you used to shower or bathe at home?
I got a walk-in combo tub shower.
Okay. And you didn't sit on anything, you stood up?
Stood up.
Okay.
Okay, so immediately she's having him do the activity, but she's also at the same time she's talking to him in a very informal, comfortable way and trying to get background information about him, because she's not going to be just bathing him, she's also sort of building up that occupational profile that you probably heard about in Foundations, where she's trying to find out about him as a person, how he managed at home, what equipment he may or may not have at home, how he did things at home, because if she can replicate things as close as possible considering the injury he had, you know, that's going to be better, but she may not. So it's important for her to know if he only had a bathtub and he's not able to walk, and he didn't have a shower, let's say, within the bathtub, so then you have to, you know, as OTs, we're problem solvers. That's what we are, we're problem solvers. So then she would have to figure out a way for him to get in and out of that tub safely, and then how to make an adaptation so that she can convert that faucet into the tub into perhaps a handheld shower. But he has a shower tub combo, so that means that he's got a shower head coming off the wall. Sorry.
Now, do you live by yourself?
My wife and kid.
Do y'all live in a house, like a one-story house?
Two-story house.
Two-story home, okay. Are you gonna be able to do most of your living on the first floor?
Yeah.
Okay. So before your accident, did you take care of yourself?
Yeah.
You were independent with all your dressing and bathing?
Yeah.
You didn't have to use any sort of adaptive equipment or anything like that at home?
No.
Okay. So what did you do?
I'm a postal clerk.
Full time?
Yeah.
Okay. What is she doing now, and why?
Blocking his genitals.
Exactly. So, she's blocking it from the camera. However, you're gonna see that soon she's gonna put a towel over there. And so, you know, a lot of people, especially older people, when they're in the hospital and people have to do things for them, they're not quite as concerned about privacy, nudity, like younger people. Younger people get a lot more upset by somebody else looking at them, touching them. Older people, not so much, because I guess you reach a certain point where you know it's got to get done, and so what, and they work with people every day, and so on. Having said that, you always want to preserve someone's dignity. So, if he was a woman, and she already washed her chest, let's say, you take a towel and put it over the chest while they're washing other parts. So that's a very common practice, that you cover the parts that you either didn't get to yet, or you already did, because you want to, cover the essentials, just to give the person a feeling that they're not a patient, that they're a person.
Dr. Smith, quickly.
Yeah.
He said he was a full-time postal clerk.
Yeah.
But in the assignment, it says he's retired.
He's retired because I couldn't remember
Okay, so you
what his
know who you're
occupation was. So
talking-
he's retired. Okay? That's why I make him older. Yeah. Well, now that I know he's a civil servant, it's very likely that he did retire at age 60. So, okay, continue? Okay. And this, and it probably makes the note easier for you, because obviously he's probably not going to be able to go back to working in the post office unless he had a desk job. If he was a mail carrier, he wouldn't be able to do it anymore. If he was somebody who stood and sorted, probably wouldn't be able to do it anymore. So it'll just make it easier for you guys.
All right. That's about as far as I can.
That's fine. Okay, go ahead and dry off. Now, when the nurses have been helping you, have they been washing your legs and feet?
Actually, my wife does.
Your wife does it? Okay.
So think about it, that's an important point.
Start with your shirt.
I'll tell you why I'm saying that. The reason I say that's an important point is, well, there's several reasons probably why his wife does it. However, if you're going to be making recommendations about how he can do it more easily himself, setting him up, long-handled sponge, whatever the technique may be, if he's planning on going home and having his wife still do it, that may not be the best use of your time. Okay? But we don't know that. She's just doing it now.
Just having this. Okay.
So he can move his arms, but he can't turn his body by himself.
You know, getting it down the back.
Part of his body by
I'm gonna
himself.
actually, if I can recline you, it'll be a little bit easier.
Okay, I just want to mention one more thing. You guys learned about body mechanics in Kines Lab, right? Okay, so she's got this rail up. He needs the rails. He needs the rails to turn. But she's making it easier for her back. So she's not going to do this. I don't remember her doing this, but the best thing for her back, if she was trying to protect herself, would be to lower the rail, you know, raise the bed up so she doesn't have to bend forward, pull the shirt down, have him go back flat on his back, put the rail back up, and so on. Because it just takes one time to do something wrong and you can mess up your back. And that's the truth. So you want to do things not only that are safe for the client and facilitate his independence, but you also want to make sure that you take care of yourself too, your safety as well.
Okay. Roll towards me.
Did you see how she bends his knee? Because that's going to make it easier for her to turn him.
Now, I understand you had an NG2 when you came in yesterday. So have you been feeding yourself?
Yeah.
Okay.
I just want to make one comment about these boots. So these, it's hard for me to tell, but these look like Rook boots. And Rook boots, I can't tell if they're sheepskin or if these are inflated. But usually what they do is they want to keep the ankle in 90 degrees of flexion so that the person doesn't develop contracture. So what happens is the position of comfort for most people is where when you're lying down and your feet sort of plantar flex, and so like kind of like ballerina toes. And because he can't actively bend that ankle, he's at risk of developing a flexion, extension contracture of that ankle. So you have to think about it. If he was somebody who had the possibility to progress to the point where he's gonna stand and he's gonna walk, and if he had an ankle contracture, he's not gonna be able to do it. So the thing is also that you also always wanna maintain range, whether it's gonna make a difference or not, just in terms of keeping joints flexible, making sure that the person can, can be moved in the normal ways. Let's say he's gonna be going out and he has a contracture of those ankles, it's gonna be hard for somebody to get him into a wheelchair that he's gonna be able to sit, get shoes on and things like that. So these are all the calculations that you guys have to make when you're working with patients. Now the other thing that this thing does is it makes sure that the heel of his foot is not directly rubbing against the mattress and the sheet, because that's gonna lead to skin breakdown. And you wanna be preventative. Yeah, that looks like a Rook boot.
What's
Have
it
you had any
called?
problems with your
Rook.
skin, any pressure sores?
It doesn't matter, there's different names for them.
You get
Okay, you
any
guys all know what
sciatic?
this is, what she's putting on? Ted hose. Those are those elastic stockings that I don't know how anybody could ever put them on themselves, some people do. They're very hard even for therapists to get on. She's got the added challenge that he's got full length ones. So she's got to bring them up above the knees. To me, they're always been very hard to get on, always hard. It's like putting on, stockings that they're so strong, the elastic, it's almost like, and this is before your time, it's almost like putting on a girdle in a way, because it's so strong, the elastic, and there's many reasons why these are used. They usually provide compression, and the compression is going to help him with his blood pressure. That's one of sometimes they're used for swelling. A lot of times they're used to make sure that the person doesn't have orthostatic hypotension. She's also going to put on an abdominal binder for the same reason. The abdominal binder as well is going to offer some compression that's going to help him make sure that his blood pressure stays up and he doesn't bottom out if she has him sitting up.
It's almost gone, okay, good.
Now there are devices available to help patients get these on themselves.
What is the name?
TED host, thromboembolic deterrent stockings, TED.
Some of it cutting up your food?
And you have to make sure
Okay.
that there's no wrinkles. If there's any wrinkle or fold over, he's gonna get a skin breakdown. The other thing I wanted to say is, sometimes you can order a certain amount of resistance to them. So you'll also, I don't know how many of you know nurses. Do you know anybody know nurses that stand on their feet all day? Yeah, okay, so they tend to complain about their feet hurting, their legs hurting. So a lot of them just buy, in the uniform stores, they sell socks, they look like regular socks, but they have a certain amount of elastic to them for the same reason.
I'm putting these stockings on you. to
She's
help
pretty
you with
good.
Your blood pressure, any symptoms of autonomic dysreflexia.
Which we'll talk about
And
today a
since
little
you
bit.
haven't been up yet in a wheelchair, you might feel a little dizzy when you sit up. So I'm also gonna be putting on an abdominal binder.
Okay.
So tell me, what did you do for fun at home?
Play with grandkids.
Play with the grandkids? Did you get any hobbies?
I just work on cars.
Work on cars? Like antique cars or?
I just work on old cars.
Okay. Now I'm gonna put your depends on you.
Okay.
Okay, and you understand that the
Why do you think she's putting depends on him? What?
Involuntary bowel movement.
Exactly. He's got no bowel and bladder, voluntary bowel and bladder. So, the nice thing is here is that, you can't really tell from the picture, but the nice thing here is that she's calling it a depends and she's not calling it a diaper. So again, that's just another way of giving the person a little bit more dignity. And, there's pros and cons to trying to get a diaper versus a depends on and off.
this collar that you have on, you wear that till you're about 30 degrees in bed, right? And then we gotta put on the C-Tiliso.
Yes.
Okay.
I was just gonna say, people that have back surgery, they often are prescribed a brace called a TLSO. He has a CTLSO because he has that cervical, it's gonna be attached to cervical collar. But if somebody has back surgery, they usually don't want them bending their back, twisting their back, and so on. So they'll fabricate or they'll order a brace that goes, it's sort of like a clamshell, like the Ninja Turtle, like something that fits on both sides. They're very hard to get on. Usually the person doesn't need it when they're laying in bed, but as soon as they're gonna be up, they have to wear that. Now this is a good choice of lower body garment for him, in one sense, because it's got an elastic waist. So she doesn't have to fuss with, like buttons, zippers, and things like that.
Vision or hearing?
I will tell you though, that usually he's gonna need help putting on his pants, that's the bottom line. She can teach him how to do it by himself. But usually I don't recommend, me personally, pants that have the elastic by the ankle, because if somebody has to put it on by themselves, it just makes it harder to sort of get it on over their foot. But, yeah, I guess everybody's got a different preference.
Vision, do you wear glasses?
Yeah.
Most of the time, or just to read?
Just to read.
Okay. And smell and taste and all that?
It's good.
Okay. Now, I know you said you felt tired. How's your sensation been in your hands and arms?
Just a little bit.
A little numbness? Where?
Down here.
Okay. Not on the other side?
Just a little bit.
Just a little bit, just on that back part?
Yeah.
Okay. Does it run all the way down to your fingertips?
Just right here.
Okay. Does it interfere with you trying to do small movements like buttons and snaps and things like that? Opening packages?
Yes.
Okay. All right. You want that one? Do you want your binder under the shirt?
Oh, it's a
Over the shirt? Okay. Okay, come on back.
No, this is just a FYI kind of thing. It's gonna seem a little odd, she pulled the pants all the way up by his feet. Normally you'd want your pants down by your ankles. The reason she did that is it's just gonna make it easier for her to pull them up over his hips. That's the only reason why she pulled them up, especially it's not over skin, it's over these stockings, which is gonna give some resistance.
You feeling dizzy or anything like that? A little bit, yeah. And that's normal if you've been in.
What's unusual about his position in the bed?
Sliding down.
Sliding down, exactly. So it's probably not that comfortable for him, but she probably just wants to get it done. Otherwise, she could hypothetically stop and pull him up. The other thing is that because this is a hospital bed, and you can see it a little bit, that the knee part is a little bit up. So that will help the person from sliding completely down in the bed. What happened was, when she flattened out that bed to help her with washing and dressing, whatever, then when she put it back up again, the knee part automatically goes up with the head part, but in the meantime, he had slid down. And that's what the problem is. So you may find yourself sometimes working with somebody where you often have to kind of rearrange them, reshift things, and you know, that's just the way it is.
In the bed for a little while, okay?
Oh, and there's one other thing, I hope I don't forget. So one other thing that, I don't know if you guys caught it, she was asking him about his cervical collar, and I don't know if you caught that she was asking him, do you have to wear it like when you're up more than 30 degrees? And he said yes. So that's another one of his precautions. He probably wears it all the time though, but it's probably even more important when he's up even just a little bit. If he still had the NG tube, okay? If he still had that nasal gastric tube, if it was still running, if the feeding was still running, she would not be allowed to lay him flat. He could not be any lower than 30 degrees unless she turned the pump off. And the reason is because then all that liquid could go down into his lungs and he could aspirate. So 30 degrees is usually the minimum that you want to have somebody reclined if they have an NG tube. But he doesn't have his anymore, thank God.
I'm just gonna stop this out. Since you wiggled it into the bed.
Then again, this is a great strategy. Roll it up, put halfway underneath, roll over, and then unroll it on the other side. Even if you're changing someone's sheet, this is a good, or pad, this is a good way to do it. Diapers. So they'll often recommend an abdominal binder for people that have orthostatic hypertension.
Good, have enough?
Okay, so this is his CTLSO, his brace.
Put your shoes on and then wanna have someone else come in and help me, we're gonna put your CTO on, or CTO, so.
I wish they showed the part where they transferred him, but they didn't.
Okay, now Mr. Mullins, what I want you to do is do some grooming tests for me. I need you to.
Okay. He's got this brace on. If you had a brace on for your neck, how would you brush your teeth? How would you rinse? Think about it. He can't bend, it's not allowing him to bend his neck. So if you're brushing your teeth, you take a sip of water and you bend over the sink to spit out. So before you see how he does it, I want you to try and problem solve and think, how could he possibly do it? Have like a little something there he could spit into. Now, he has one you can see in the mirror, that little kidney-shaped dish. He didn't use this, but that would be the way that you would do that with someone if you were trying to get them to, to spit out. Let's say he had long hair and he wanted to comb the back of it, and again, he can't flex his neck. So then maybe you'd use some sort of adaptive equipment, something that had a longer handle. So all of these kinds of things are the things that you guys as therapists, you're gonna have to problem solve.
You wash your face, wash your hands, brush your teeth, and brush your hair. And I understand you're not able to shave because of the collar, right? So how do you get that done?
Well, at last time they said, my daughter.
Okay, so somebody else did that for you. Okay, go ahead.
All right, I'm sorry. You know this is annoying. You see the faucets? He's able to latch on. It's so much easier to have those types of faucets than the kind where you have to turn. Even for people that have arthritis or have any kind of problems with joints or strength in their hands, this is gonna be a much better option than having the kind where you have to turn, rotate. Now, you have to figure out how much strength he has by seeing whether he can move against gravity or not. So this would be like a functional manual muscle test, just watching what he does. Now, we didn't see if he took the cap on or off, but chances are he probably needed help with that. Point out one other thing, because it's hard to see. You can see it in the mirror. This is the gait belt, okay? So just pay attention to that in a little while. Okay. Look at that gait belt again. Where does it look like, I mean, can you tell if it's just around him or around him and the chair? Probably around the chair, okay? So already that's a tip off for you that he doesn't have any good trunk control, balance, because they want to make sure he's safe. What if he, let's say when he was at the sink and he didn't have that gait belt around the chair and he automatically, he goes to lean forward when he's brushing his teeth, he could fall flat, exactly. So, and then this is the rest of the brace. So they put on a part that attached up there, came down, and then this is the rest of it. I don't know if there's a bottom part as well, I can't tell. And he even has a belt here, a wheelchair seat belt.
Mr. Mullins, I'm gonna have you do some common everyday tasks, kind of check your strength, your muscle power, and your energy. This is a 5-pound bag. Okay?
I've never seen anybody do this before, just by the way. Now she doesn't have to worry about him falling because he's all sort of locked in there.
Now, is that because of weakness or pain? Okay.
What did you say?
She asked him, is it weakness or pain? Because he couldn't lift it all the way.
And what did he say?
He said weakness. Okay, look at the difference between the two sides. So, we're going to talk about spinal region today, but if he was a complete spinal cord injured person, it'd be pretty symmetrical, the deficits on both sides. So chances are he's probably an incomplete spinal cord injury.
That strap across your chest would be a little tough, right? Have you had trouble with your balance, your sitting balance?
Yes.
Okay, same thing with this. Okay, we'll just start from right here. How high can you go? Okay.
It's a lot lighter,
Good now.
probably less than a pound.
Good. Okay, I want you to take this lid all the way off.
So this is a normal two-handed activity.
Good.
And it's large. But I don't know if he could do that with the toothpaste cap.
You look kind of surprised.
Yeah.
Okay, and next I'm gonna check your grip strength.
Okay, we can't see the numbers, so you can't really
I need you to hold
comment
it
on
like
that.
this. Yes, and not resting on anything. Okay, squeeze. Good, relax. Okay, we're gonna do it 2 more times. Repeat it with this side.
Now he's, if he's a right-handed person, it works in his favor, that he's got a better strength and control in that right hand. If he's a left-handed person, not so much. She may end up perhaps switching more things to the other hand, but perhaps not. She may sort of work it out, you know, a different way. Okay, so you guys all have an idea of what to put in your notes. So this was a typical, this was a somewhat typical session and assessment. But did you see how she sort of wove questions in to get some information from him as she's working with him? So that was very, very nicely done. And the other thing is that if you notice by the sink, he was using his toothbrush and his toothbrush holder and his spray, and you know, so that's another way that you sort of give dignity to the person by having them use their own things. It's not so clinical, you know, by having them only use the things that are supplied, the generic things supplied by the hospital. Same thing with putting on his own clothes. You know, I mean, if someone is attached to all kinds of tubes and wires and things like that, they have to wear a hospital gown because, you know, there are things that have to be done in order to take care of them, so they need an easy way to access the person's body. But in his case, you know, you can even think of psychologically how much better it is to be able to wear your own clothes. So, and this was actually a very, even if she wasn't doing an evaluation, this was a nice, typical session. She had him wash, get dressed, you know, wash up at the sink, trying to simulate, you know, as much normalcy as possible. So that's what I liked about it. Okay, any questions? Okay, all right, so where are my dermy dancers?